Hey everybody, this is Dr. Diane Mueller, and in this video we're going to talk about mold and mycotoxins, the toxins from mold, as well as toxic metals and some of the impacts on the brain. So it's really important to understand that we can develop blood-brain barrier disease. This is essentially when the brain becomes leaky, and when the brain becomes leaky, there's less of a barrier separating the brain from the rest of the body, meaning things can get into the brain a lot easier. So what we see with blood-brain barrier disease is we can get toxins into the brain at a much higher rate when the blood-brain barrier is leaky. And these toxins can be all sorts of things. In this video, we're talking specifically about mold toxins called mycotoxins, as well as toxic metals. When these types of metals and mycotoxins can get into the brain, they can cause all sorts of things. We can actually have the brain increase its level of what's called reactive oxygen species. This is basically the brain essentially trying to attack these toxins and remove them, but subsequently creating a large enough chain reaction that we get an inflammatory stress in the brain, and this can actually cause our nerve cells in the brain to die. So it's really important that we work with blood-brain barrier disease. We absolutely don't want those toxins in our body to begin with, but you also need to talk and think about how does the blood-brain barrier get leaky. And there's a couple things that are very clear in research from this perspective. One is high cholesterol. So high cholesterol in the blood can actually lead to blood-brain barrier disease. So if you have mycotoxin illness or you have metals or you suspect these things, you want to make sure you're really also managing your cholesterol to prevent these things getting into the brain. Another thing that can cause blood-brain barrier disease is a symptom or a reaction to something called a gram-negative bacteria. Gram-negative bacteria are classes of bacteria. Things like E. coli, for example, that you probably have heard of, is a gram-negative bacteria. When gram-negative bacteria are in our body, they can be in our intestinal tract, they can be in our urinary tract. When these bacteria are in our body and they're pathogens, our body will attack them and they die. When they die, they release something called an LPS, a lipopolysaccharide. When a lipopolysaccharide is released due to a gram-negative bacteria buildup, these lipopolysaccharides will go to the brain, and what will happen is they will actually cause blood-brain barrier disease, allowing some of the mold, some of the heavy metals, as well as other types of toxins into the brain, which can cause all sorts of neuronal inflammation and sometimes, in certain cases, even nerve cell death. That's it for this video. Please subscribe to the channel if you're enjoying it. See you next time.